All right, Aditya. So in marketing, we're always trying to get into the heads of our customers and our buyers. So for the sake of this exercise, let's pretend I run patient access at a multi-site health system. And yesterday, my CFO pulled me into a meeting and asked me a question. And she said, of all the referrals that came in last quarter, how many actually turned into a booked appointment? And the ones that didn't turn into a booked appointment, what happened to them? Where did they go? And I know that as a leader at my system, I should know this, but I imagine the data is spread through so many different places. The other issue that I'm having that is if the patient doesn't book, there's like no person or system that's really tracking where they went. So unfortunately, I'm left like giving my CFO the best answer that I possibly can. How would one find the answer to this like by tomorrow?
So, yeah, I mean, Alex, it's a great question. I'm sure that like you, our fictitious access leader, represent any access leader at any health system because it's a problem that question we hear all the time because the data is there. It's just stuck between the seams of various systems. So let's take your example for a little bit. The referral sets in your referral management system, scheduling is in the EHR, maybe the patient outreach is from Luma. The problem is you're accountable for a number that lives in like 4 or 5 systems that you're not really the owner for. And then putting all that stuff together and like reasoning to find the answers from a variety of questions, that gets really, really tough. So what a lot of healthcare leaders in your situation are doing is they pull a report from the EMR, they pull a report from the scheduling system, from the referral system, from the patient outreach system, hoping that maybe the patient IDs match, trying to get some clean data, maybe they give it to an analyst. It takes weeks or even longer. Honestly, by the time you get your answer, the patients, they've already gone somewhere else to get their care. So this is kind of what the power of the magic of MCPs are. They let you read from all these various systems and allow for an AI to actually reason on that data, pulling that data together, ask questions that tie that data together and produce results that give you the right information at the right time with the right permissions and the right security. In other words, MCPs help get rid of the seams. So Tashfeen, you want to walk us through how this works?
So as a referral coordinator, it's really important for me to be able to track my referral process. So here I've hooked up my Claude desktop instance with Luma Health MCP, and I want to be able to track what the progress is. So I asked it already, like what is my pipeline or what is my referral status look like? So I found that we have 8 active referrals, 1 is pending. So now as a referral coordinator, that's a little bit concerning why I have so many active and 0 have been scheduled. And so then I go ahead and ask a follow-up question like, what's going on? How can I increase his conversion? And so it starts to look at the data there, looking back, leveraging the rich data that we have living in our MCP server. And it finds that something very reassuring to me as a referral coordinator, saying that, okay, all these 8 active referrals, it's just that we've only attempted to reach out to them once, which makes sense. Sometimes it takes more than several attempts to be able to reach out to them, but it also helps to take that data and starts to give me other insight. So it has access to my settings. So it starts to tell me things that maybe I can do to optimize that referral conversion. And so these are things I can look at as a referral coordinator to be able to adjust my Luma Health settings. Now, I like this. I like the insights given me. I like these other things too. But as someone who wants to be aggressive about filling the appointments and getting in the referrals now, I asked the question, hey, what can I do? Like, what can I do now? What can I do without having to adjust these settings yet? To be able to really drive conversion. So I said, at the end of the day, as a referral coordinator, I have some staff available that can actually make a high-touch call to these patients. So then I asked, so help me triage this. There's 8 or 9 patients. I don't think I can call them all today. And so figure out for me. And so it will extract the demographic data that we have about these patients and be able to figure out, hey, like here are 3 patients that are likely to convert. And so it says there's this 1 patient who hasn't been reached out. So maybe that's a high likely patient to be able to convert. And there's 2 other patients who are at lower risk of canceling. And so these are patients that a high touch outbound call could help. And so quickly as a referral coordinator, I'm able to figure out what my referral pipeline looks like, be able to address any questions of, hey, are there any problems? Maybe I haven't reached out to them enough. And then finally be able to see like who are patients who I can maybe actively reach out to right now to be able to and convert them and help leverage my staff that's available. So I hope that helps to understand the kind of combination of us being able to use AI agents and leveraging Luma Health MC.
There it is. Alex, you can actually get answers for your CFO right now with real numbers.
This is incredible. So a couple questions after watching that. So 1, why does MCP make something that's so complex and disconnected feel really easy to solve now? And then 2, how is that different from some of the APIs that a lot of leaders have in place today between their technology systems?
Yeah, maybe we'll start with the second one. APIs are really great at connecting like discrete data. I need to get point A to point B, right? That's powerful. It lets you do a lot of stuff. What they don't let you do is put a mixed bag of data together that's potentially ill-formed or ill-formatted, not perfectly integratable, and apply reasoning on top of that. That's the power of MCPs, because it gives the AI models like your Claude, your OpenAI, whatever it is, your ChatGPTs, the ability to see into those systems, reason on them to answer questions about the data. So that's what's actually being able to harness the power of the data in the EMR and everything in between to analyze the systems. It takes kind of what we will love about APIs, but actually allows you to apply reasoning on top of it so that you can answer those questions that your CFO might be asking.
That's awesome. All right. So, for all of you access leaders out there or anybody else that's interested in all things AI as it's developing very quickly, there's more information at lumahealth.io. We have an entire series defining and diving into all things AI. Hope to see you there.
I'm going to push play.
Okay.
Is it rolling? Is it rolling for you?
It's rolling. Yeah.
Oh, that's cool. Okay. Do any flyaways? Of course I do.